There's a spectrum of gluten intolerance, and at one end is celiac disease. And celiac disease is a chronic, lifelong, genetically based autoimmune condition. In your small intestine you have villi, and there are these finger-like projections, and that's where all of the food in your body is absorbed. And what happens in celiac disease is there's an inflammatory process where slowly over time those villi are damaged until they're not there anymore. When this happens, you're pretty much not able to absorb the foods that you're eating, and this leads to all sorts of complications, from infertility to osteoporosis to anemia, to all sorts of neurologic issues, headaches, you name it. Essentially you're not getting the food you eat, and so the range of symptoms is pretty significant. So this condition, basically, it can only happen if you have the genes for celiac, if you're eating wheat or eating gluten and having some sort of trigger. For some people it's a stressor in their life, so marriage, divorce, getting sick, having surgery, getting pregnant, whatever it may be, and they go from simply having the genes to having celiac disease. So 30% of us just walking around have the genes for celiac. About 1 in 133 people actually have celiac. It's really something that's really only been on our radar in this country for about 10 years. The first celiac center was established 10 years ago, and so many doctors or many healthcare practitioners didn't learn about it in school because it wasn't something we knew about. And of course, if you have, since it's a genetic disease, if you have a relative with celiac, it's much, the likelihood goes up kind of exponentially from there. Celiac disease is diagnosed from doing a blood test. If the blood test is positive, they go on and do a biopsy. And it's incredibly important to get this done before going on a gluten-free diet. And the reason is that once you take gluten out of your diet, everything goes back to normal. Your blood test goes back to normal, your biopsy goes back to normal. And depending on your age and different things, it depends on the window of opportunity between when you've stopped eating and when things heal. For someone with celiac disease, even having a crumb of gluten can cause damage for 6 months. And when I mean a crumb, it's the amount that can cause damage is the amount that can fit under your pinky, which is minuscule. The whole thought is that most people are safe when they're eating less than 20 parts per billion of gluten, which is basically a speck. And so that's why it's important to know how strict you have to be, so people know basically the consequences, whether it's a matter of just feeling poorly for a while or really doing a significant amount of damage. And that is part of the reason that I really encourage testing. I find that when people go gluten-free without having a very firm diagnosis, most of us like bread. Most of us like being able to eat what we want to eat, do what we want to do. And then there's this sort of tendency to say, well, I don't really know for sure. It's my birthday, it's Christmas, I'm at a wedding, the chocolate chip cookie was looking at me, and it's melty and it's perfect. I mean, we start making these excuses to do what we want to do because we enjoy it. And so being told that's it for life, and that's the presumable future, that's kind of where it's going to be for a lot of people, provides some structure. The other thing is other conditions. Anyone with celiac should have their vitamin D tested, and their iron and their B vitamins and other things looked at. For women, I've seen so many women in their 20s and their 30s with osteopenia or osteoporosis. That's not a test that doctors generally do among women of those ages, and so it's really important to get a diagnosis so that your doctor can follow up accordingly. So there are a lot of good reasons to, before you do anything else, figure out which camp you fall into, so basically you can make an informed decision of what you want to do and where you want to go from there.